Great. Thank you very much, everyone, and it's great to be here. And I know the timeline, I couldn't resist as a researcher not to use the PowerPoint, so I do apologize for that. So without further ado, I'll just move right along and say, really what I want to talk to you tonight about is comprehensive school health research approaches. And really the whole emphasis of why I even got into this really reflects on I am a nurse. I saw too much chronic disease and illness coming through my doors, and I was caring for a lot of elderly people that had already had problems in their lives. And really what happened was I had a deja vu. Let's get to where the real prevention focus needs to be. Let's address youth, and where do we see youth? The population in the school setting will seem to be the right place to go. So when you're looking at things like chronic disease, such as diabetes, such as cancer, such as COPD, and so on, we need to prevent that very early. So changing the culture and the practice with youth was really important. So my goal as a researcher was to conduct high-quality policy-relevant research that contributes to the school environment, using a socio-ecological approach so that we can really address it at the individual school, child level, right into a classroom, to a school, to a community, to the policy. So it's not enough to say it's going to be at the youth level, we have to get it into the policy level as well. And the key is you can't do that alone. We have to work in partnership with local partners, provincial partners, national partners, international partners. And together we can make a difference. So I do like your comment today. So what do we mean by a comprehensive school health approach? Really, I use the framework called the Joint Consortium of School Health Framework with 4 pillars where there is teaching and learning, partnerships and services, social and physical environment, because both matter, and the healthy school policies. So when I'll show you that diagram in a moment. And the idea behind it is using this comprehensive approach will help us understand more effectively what the school health landscape is about. Because very often teachers will say, we can't do it alone. So school health isn't about schools alone. School health is about the school within its community working together as a whole. So the comprehensive nature of the work is really looking beyond the behaviors. It's actually looking at the environment as well. And I happen to really focus on 4 behaviors for our work. And it's on healthy eating, physical activity, mental fitness, tobacco, and drug use. So those are the focus of our surveys, but the surveys can be just tools to gather data, and that can change and be adjusted according to what are the needs of the community or the society. So what we have is a comprehensive picture. You can see the social and physical environment there, the teaching and learning environment, partnerships and services, and healthy school policies. And this is how we structure what we believe is a healthy school environment for learning and for health. So what does that look like? It engages students, teachers, parents, school boards, alliances, non-government organizations, researchers, and government departments, all coming together. And here's the researchers working with monitoring and evaluation. So collectively, we can come together as a team. So what does this mean to me is we have a program called SHAPES, and SHAPES stands for School Health Action Planning and Evaluation System. And it's a population health monitoring system, and the idea behind it is communities tell us they need locally relevant data. They need data that they can work with to inform their actions. They need timely access to data, so data that shows up 18 months or 2 years after you collected the data is nearly passé. You've moved on to other things. So the timeliness of getting that data is critical, and the type of data that you receive in a useful format is critical as well. So what we call SHAPES PEI, and you could call it SHAPES Nova Scotia if you like, or SHAPES New Brunswick, it doesn't matter. But we just called our SHAPES PEI framework, and it's based out of a model that I worked with colleagues in Waterloo as well as across Canada in developing this. And we call it a platform for learning. And you can see the underlying is our research, but what we have is a school health assessment component. So that's our data surveys, but with students. But we also collect student principal level data, where we look at the policies and programs that are in the schools. We also look at the community level data that's available in terms of what are the programs available for youth. And then all the feedback from that data is generated into a feedback report that goes back electronically to each individual school that participates. And that, in those data, is here's your school results. The second part in the report is, should you take action? How do you compare nationally or to other data sets that we have? And should you take action, here's some recommendations for action. So it's an entire package that we gave. And the idea is those reports then becomes tools for local strategy and context. And then we run more surveys to see how are we doing? Are we making any differences? So I wanted to just throw a few, of course I have to give you a few slides, couldn't help myself. But I wanted to share this one with you because mental fitness is a term that was developed by Dr. Bill Morrison and colleagues out of New Brunswick. And it's based on self-determination theory, and yesterday's lecture, yes, someone was talking about self-determination theory being very important. But how we look at it for youth, there's three components of self-determination theory that really measures mental fitness. One is autonomy, and that is a child's ability to make choices and decisions, so they're able to make wise, sound decisions for themselves. The second is relatedness. Related means how connected they are to their family, to their community, to their school. And that sense of connectedness gives them a sense of self. And the third part of self-determination is competency or self-efficacy. How confident is the child or youth in their ability to make the best decisions, whether it's on healthy behaviors or if it's about work decisions or travel decisions, whatever. So how confident that they have the personal skills to make the right decisions. 1/3 of students in schools in Prince Edward Island, like if you looked at the 69%, it looks pretty good. But if you go 22 plus 9, that is 31% of students, approximately 1/3 of students in a classroom have low to middle levels of mental fitness. They don't have the confidence, the self-esteem, the ability to make decisions. That's actually an inequity. Should we have that percentage? So target positively. Instead of saying, what's the number negative, we shouldn't have 69% feeling good about themselves. We'd like to have 80%. How do we get there? Okay? Let's take a look at physical activity for a moment. Couldn't do it without that one. 55% of students in grade 5 to 12 in PEI do not meet the National Physical Activity Guidelines of 60 minutes a day. 60 do not. So we're wondering why obesity rates are where they are. There's an example. So girls, here's the inequity. Females, more than boys, are actually less active consistently. And we thought, oh, well, we're looking at grade 5 to 12. Well, it shouldn't be a problem. It must be. Let's take a look at that elementary grade, grade 5 up to grade 7. Guess what? Even in the elementary grades, girls are statistically significantly getting less physical activity than their boys, the same age. So then we also thought, okay, let's take a look and drill down the data again, because there's got to be a gender thing going on here. So we looked at BMI rates and gender together. Girls who had high levels of mental fitness were less likely to be overweight or obese. Boys with high levels of school connectedness were less likely to be obese. This is a message for us. There is an inequity issue around mental fitness and youth in our homes, in our classrooms, in our communities. And what are we going to do to advance and change that? And is it mental fitness as the trigger for unhealthy choices? We don't know the answer to that. I just raised that tonight, okay? So here, so let's, time-wise, I'll try not to take so long. Students who eat breakfast every day in a usual school week. We know there's good solid data. If children eat breakfast, their ability to do well in school, there's a direct relationship. So overall, 59% of PEI students eat breakfast every day. 59. So that means quite a few don't. 8% of students report skipping breakfast because they don't have time and they don't have enough food at home. There's no food in the fridge. 8%. So think of what they're able to do. 65% of males report eating breakfast every day, and 53% of males. So that's not good enough. Tobacco use. This is where I got started, actually. How am I doing time-wise? Am I done? Okay, I'll just finish with the last slide. We'll keep going here. These were examples of people doing snapshots of activity based on our data that they said policy and practice, we can take the data, low activity for females, they set up a gym time for females only. Positive mental fitness gym, a whole weekend at a school. Let's do some positive toolkits. And so my question for you tonight is, how do we move evidence to action using a health equity lens? How can we do better? And I could have shared a whole lot more with you, but we won't. So thank you very much.